National Guard troops are hard at work around the U.S. helping to combat the spread of the coronavirus. Troops in West Virginia have begun delivering medical supplies to 2 hospitals there. Meanwhile, troops in Louisiana are heading up several mobile COVID-19 testing centers in the state. Those centers will serve as models to be followed elsewhere. Joining me now on Skype to talk about the role of the military in fighting COVID-19 here in the U.S. is Dr. Nadja West. She is a retired U.S. Army Lieutenant General, as well as the 44th Surgeon General of the U.S. Army and the former Commander General of the U.S. Army Medical Command. Dr. West, welcome to the show, and thank you for your service.
Oh, thanks so much. I really appreciate it, Tracy. Please call me Nadja.
Well, Nadja, we are seeing troops around the country serving in different capacities. How is this mobilization helping at the state level?
Well, I tell you, the National Guard can really add to the whole of government response with public and private to basically bring everything to bear to help fight this virus. As our senior leaders in the military are saying, this is a war. It's a war on an invisible enemy, which is the virus. And so the National Guard can bring agility, adaptability, and different capabilities to support wherever the governors of the respective states decide to use them.
I know New York City is in the process of turning the Javits Center into 4 hospitals to increase capacity there. What are the challenges of transforming a place like a convention center into a medical facility, and how can these so-called field hospitals help to relieve the pressure during this health crisis?
Yeah, there's anytime you have something that's outside of your comfort zone as a medical professional, it can be challenging. But I can tell you these federal medical facilities as well. So FEMA has federal medical facilities that they set up in these large areas. Some of the challenges are because you don't have the normal environment, the sterile environment that you need. But in some cases, what you need is just bed capacity to treat individuals. Some that have the virus, of course, some of them need really more detailed and more specific care, respiratory support. But others, just routine care, you can put in some of these individual areas where they transform with cots and other types of logistical support to make them as good as they can for medical treatment.
Nadja, I'm curious, is there a risk of taking away needed doctors and medical staff from maybe their local communities and then activating them for military service?
Well, Tracy, the good news is a lot of these individuals come from those various communities that they're supporting, maybe not directly in that city, but somewhere in the state. As you're familiar with the different compos of the military, the National Guard, Reserve, and Active, which we call our total force, our senior military leaders are very good about making sure that the missions are not at risk if they do move or activate some of these individuals from different communities. So there's a lot of coordination between the states, the local governments, the national governments, just to make sure that there's not a negative impact. And so there's a cross-leveling ability amongst the different compos, and also, of course, coordination with the state and local governments to ensure that no one's mission is adversely impacted. Because I know our senior leaders have mentioned in the military that it's very important to make sure that we maintain our national security mission, but also making sure that we take care of our people and then take care of our fellow citizens who we are sworn to support and defend.
Yeah. Nadja, I know a lot of folks maybe seeing members of the military in their local communities makes them feel a little bit anxious, especially since a lot of people have been talking about martial law. What can you say to them to maybe calm their fears during this time?
Well, what I could say is, serving in the military for the number of years that I have, that there's no better group of individuals than our military members, our soldiers, sailors, airmen, Marines. And what I've seen in the past is that most individuals feel when they see the military coming, they actually are assured because they usually have been on the ground before with humanitarian assistance and disaster relief, be it tornadoes, hurricanes, floods, wildfires. And so usually when you see military in your communities, it's a good news story because they're there to help. And again, there's no better group of people to work with than soldiers who have raised their hand during time of war that we've been in for so long, knowing that they could put themselves at risk and harm's way to defend their country overseas. And they really want to do that and make sure that they can keep their communities and their neighbors safe.
Nadja, thank you. Dr. Nadja West, thank you for sharing your expertise.
Thank you so much. Appreciate you having me. Take care, Tracy. Stay safe.
Thank you, too.